Trauma is a deeply distressing experience. It leaves a mark on our minds and bodies. It changes how we feel and function. We often think of trauma as a result of huge, life-altering events. Things like natural disasters, car accidents, or physical assaults come to mind. While these events are undeniably traumatic, trauma is not limited to these obvious sources. Trauma is about how an event impacts us, not just the event itself. It's about feeling overwhelmed and powerless in the face of danger or fear. This feeling of being overwhelmed can stem from a single event or ongoing, repeated experiences. Importantly, what might be traumatic for one person might not be for another. We all process experiences differently. Our individual history, our support systems, and our personal resilience all play a role. This makes defining trauma complex. There is no one-size-fits-all answer. Trauma's impact is also not always immediate. Sometimes the effects of a traumatic event may not surface for months or even years. Regardless of the source or the timing, trauma leaves its mark on our emotional and psychological well-being. Understanding this is the first step to healing. Trauma does not only affect our minds, it impacts our bodies too. The experience of trauma is deeply intertwined with our physical selves. When we face a threat, our bodies go into survival mode. This triggers a cascade of physiological responses like a racing heart, sweating, and shallow breathing. This is a natural and necessary response. It helps us to fight, flee, or freeze in the face of danger. However, when we experience trauma, this stress response system gets stuck in overdrive. We remain in a state of heightened alertness even when the danger has passed. This can manifest in a variety of ways. We might experience chronic anxiety, have trouble sleeping, or struggle with digestive issues. Trauma can even disrupt our brain function. It can impact the areas of the brain responsible for memory, emotional regulation, and decision-making. This can lead to difficulty concentrating, intrusive thoughts, and emotional outbursts. The impact of trauma on the brain underscores the profound connection between our mental and physical health. Furthermore, trauma can manifest in physical symptoms that seem unrelated to the original event. Chronic pain, headaches, and fatigue are just a few examples. These physical symptoms can further complicate the healing process. They can be mistaken for unrelated medical conditions, leading to frustration and delayed treatment. While major life events can certainly lead to trauma, it's crucial to recognize that trauma can also stem from less obvious sources. These subtle traumas are often ongoing or repetitive experiences that chip away at our sense of safety and well-being. They are the microaggressions, the emotional neglect, the constant criticism that can leave us feeling unseen and unheard. These subtle traumas can be just as damaging as their more obvious counterparts. They can lead to feelings of worthlessness, self-doubt, and difficulty trusting others. A childhood marked by emotional neglect, for example, can be deeply traumatic. These experiences, though less dramatic than a single catastrophic event, create a constant undercurrent of stress. This chronic stress can have a significant impact on our emotional development and our ability to form healthy relationships later in life. Recognizing and validating these subtle traumas is crucial. We need to acknowledge that trauma is not always about the size of the event, but about its impact on our sense of self and our ability to cope. Healing from trauma is a journey, not a destination. It is a process that requires patience, self-compassion, and often the support of mental health professionals. There is no quick fix for trauma. It takes time to process the pain, to rebuild trust, and to learn new ways of coping with difficult emotions. Therapy can provide a safe and supportive space to explore the impact of trauma. There are many effective therapeutic approaches such as eye movement, desensitization and reprocessing, EMDR, and somatic experiencing. These therapies can help to reprocess traumatic memories and manage the physical symptoms of trauma. In addition to therapy, self-care practices are crucial for healing. Engaging in activities that bring joy and relaxation can help to soothe the nervous system. Practices like mindfulness, yoga, and spending time in nature can help us to reconnect with our bodies and regulate our emotions. The journey of healing from trauma can be challenging, but it is possible. Remember that you are not alone and that healing is within reach. With the right support and a commitment to self-compassion, it is possible to move through the pain of trauma and reclaim your life.